One of my biggest pet peeves about psychotherapy and the work that we do as psychotherapists is what I refer to as like clinical entitlement. And it starts with, and one of the ways that it shows up is people ask me questions like, Elliot, what do I do with those clients who won't talk or won't answer my questions? And the reason that is such a pet peeve is because there's a lot of privilege and entitlement wrapped up in that question. And I want to be clear, I want to really explain this. What do I do when a client doesn't talk and a client won't answer my questions? Is I recognize that I'm not entitled to my client's words. I'm not entitled to my client's story. I'm not entitled to my client's trust. I have to earn their trust. I have to earn their story. I have to earn their words. And with some clients more than others, that takes work. Because sharing your story and sharing your lived experience is one of the most brave things that any human being can do, especially sharing it with somebody who's a complete and total stranger who has a level of authority, as a clinician often does. The most common experience when we tell our story is people feeling judged and the person hearing the story being defensive. It happens all of the time. So we're kind of like conditioned to not feel safe and comfortable all the time to share our story. It happens in my life. When I talk to people, especially now, in the world in which we currently live, when I talk to people about what it's like to live in this world as a black man, and what it's like to encounter society as an African American, I often hear people judging me, discounting what I'm saying, and being defensive, explaining their position to me. And I feel like maybe I shouldn't tell my story because it is such a hurtful and dismissive thing when it happens. So we have to understand that the client is not obligated to tell us anything. It's our job to earn it. And if someone doesn't give it up right away, then perhaps they've been hurt in the past and they're just protecting themselves. They're just protecting what is nearest and dearest to them. And it's just our job to proceed with respect and with care and understand that until there's trust, I don't deserve their words. I don't deserve their answers. I don't deserve their responses. And I just need to keep going and work to earn my client's trust.